Hi, I'm Dr. Don Bonner with Personalized Wellness, and today I was going to do a talk on IV ketamine, but I switched things up a little bit because I had a patient with basically a question about care from another physician, and basically the advice that he was given was essentially advice that would have been given 20 years ago, and it just made me wonder of where we are in the state of healthcare. So today I want to really talk about patients and what you have to do to advocate for yourself and for your health. So again, I'm Dr. Don Bonner with Personalized Wellness. Please click the subscribe button at the bottom down here. That helps us out as a YouTube channel. And if you can, hit that little bell, and that tells you when I've posted another video. So today I want to talk about, I want you to please question your doctor, your diagnosis, and your treatment at all times. And I want everybody to realize how much information is out there at your fingertips right now. To question everything that's done, lab work, medication you're being put on, you need to question everything, because essentially if you don't question, what happens is you're at the mercy of a physician who may be practicing medicine from 20 years ago. And I see it all the time. I have patients come in. I'll give you some perfect examples. These are very good examples of what I will typically see. A lot of this comes down to thyroid's a very common one. You'll have a patient that you've put on thyroid medication, an appropriate medication that has T4, T3 in it. They'll come in and say their TSH is suppressed to 0.4, but their free T3 is perfectly normal. Their total T4 is normal. They feel great. Their hair's stopped falling out. They have more energy. They're losing weight. They go to their endocrinologist and they freak out because they tell them that now you're hyperthyroid, that this doctor has made you hyperthyroid. You're going to start losing bone mass. You're going to develop atrial fibrillation. So we need to get you off of that medicine that he's got you on and put you on Synthroid. I see it all the time. And another one, hormone replacement therapy, men and women. I'll have a 65-year-old woman come into the clinic that says that their OB-GYN has told them that they don't need hormones anymore because they're older than 63. I have no idea what that means. And I'll have males come in who are on an appropriate dose of medication, say they're on testosterone cream, and their testosterone's 1,000. They feel great. They have more energy. Their libido's back to where it used to be. They feel wonderful, but they go to their urologist, and the urologist tells them that their testosterone is way too high, that they're at risk for prostate cancer. I mean, that's totally antiquated as far as those thoughts. But again, I see it all the time. Diet and nutrition, I see it with diet and nutrition. We see it with so many different things, folks. So what I'm really trying to tell you is you have to advocate for yourself. You have to research. You have to look at different perspectives on things. A lot of times, things that come out in the medical literature, they don't get into practice for upwards to 15 to 20 years. It takes that long to supplant this dogma. And what you have to understand is that a lot of doctors out there are getting their education from pharmaceutical reps and drug reps. I hate to say that, but it's true. And you've got to advocate for yourself. There's some really good sites out there. I'm board certified, and I've got a fellowship with the American Academy of Anti-Aging Medicine. They put out a lot of good information, a lot of good physicians coming out of there that are much better educated on all of these different modalities. AGGM, I think, is one of them. The Institute of Functional Medicine. if you look, there's a lot of different sites out there. There's webinars, there's YouTube videos, there's a lot of things out there that you can be educated on. And I would encourage you to get as educated as possible. One of them that I should have put on here was statin therapy. I mean, I catch a lot of grief about statin therapy. You know, patients will come in with a cholesterol of 240 and they're on a statin medication. You'll fractionate their cholesterol. Their total particle count is not elevated. They don't have oxidized LDL. You do a coronary calcium score and it's 0, and they're on a statin. So I don't understand. I don't understand it. And patients, again, you just have to advocate for yourself, because nobody else is really going to advocate for you. Do your research, look things up, and try to become as educated as possible, and ask questions. And again, if you talk to your doctor and they give you a diagnosis and they tell you that this is the medication you need to be on, question everything. Look it up on your own. Ask them questions. And if they are upset that you ask them questions, go to another doctor. I firmly believe that, because a physician should be confident in what they're telling the person. And if something comes back contradictory to that, they should have the fortitude to say, okay, maybe I'm wrong. Maybe I'm wrong. Where are you getting this information from? Look it up and see if maybe it questions your particular dogma. That's my phone going off. Sorry about that. But again, Dr. Don Bonder with Personalized Wellness. Give us a call, 601-898-0911, and we'd be happy to see you in consult. And again, hit that subscribe button.